Hello everybody. Good evening all. So am I audible clearly? I'm Dr. Poonam Agrarwal here to discuss you certain image-based question. So just reply in the chat box if you can see and hear me clearly, all of you. So good evening everybody. So shall we start the discussion? I hope it is clearly audible and visible. So I have got certain image-based questions which I'll be discussing one by one. And there are important concepts behind each images which I am going to discuss you now. Alright, so the first question which I have brought it for you is this one. It's a Lineweaver-Burke plot or double reciprocal plot. So if we talk about this is a Lineweaver-Burke plot. I write the name here, Lineweaver-Burke plot or double reciprocal plot. Double reciprocal plot. It is called double reciprocal plot because we are using the reciprocal values of velocity and substrate concentration. So they are not directly plotted on y and x axis respectively, rather 1 by v and 1 by s is plotted on y axis and x axis respectively. So this is a Lineweaver-Burke plot which is importantly being studied to study the enzyme kinetic. In this they are asking you what is the value of Km for the enzyme depicted by curve A. So let's focus on curve A. This is curve A and it is seen to be merging at minus x-axis at this point, which is written as -2. So it is asking you calculate the Km value. You must know whenever we are talking about Lineweaver-Burke plot, the line which is representing the enzyme kinetic, wherever it is intersecting the minus x-axis, that point is representing you the value of 1 by Km. So this -2 is actually the value of 1 by Km. So we understand the value of 1 by Km in this plot is given -2. In fact, minus and plus signal are not having any statistical significance, rather they are just denoting you that if it is minus, it is towards the left side of the 0, and if it is plus value, it is on the right side of the x-axis. So 1 by Km value is shown to be -2. We can omit this minus symbol here and we can see that 1 by Km is 2. So if we calculate the Km, it becomes 1 by 2, which is going to be 0.5. So what is Km? Km is the substrate concentration at which velocity is half max. So it's something like substrate concentration at which the velocity of reaction is half max. So now if we see this plot, which is given in the question, the substrate concentration is represented in millimole unit. So of course the Km value also will be represented in millimole value. So this 0.5 which we have calculated, the unit of it is going to be millimole, because Km value is the substrate concentration only, and the substrate concentration in the given question is represented in millimole value. So Km is going to be millimole value, and that's going to be 0.5. So the answer for this question is going to be option A. It's not a very difficult question. But to solve this question, you must understand that Lineweaver-Burke plot. I am just summarizing Sheikh Abdul Sohail. So are you understanding this? This is Lineweaver-Burke plot, and they're asking you what is the Km value of the enzyme, which is represented by curve A. So to solve this question, you need to be familiar with Lineweaver-Burke plot, which otherwise is called double reciprocal plot. This is called double reciprocal plot because here the enzyme kinetic is studied on a one by velocity value and one by substrate value, which are drawn on y and x-axis respectively. And for a particular enzyme, the kinetic is shown by this kind of linear line which is intersecting the y-axis at 1 by Vmax value, and when virtually it is merged on minus x-axis, that point where it is merging is representing you 1 by Km value. So if it is plot A and it is asking you what is the value of Km for the substrate which is shown in plot A, then you understand that 1 by Km value is minus 2, it's given in the question, and minus symbol we are omitting because minus is just denoting you that it is towards the left side of the x-axis from the point 0, so it is having no numerical significance. So 1 by Km in fact is representing you 2 value. So Km is thus calculated as 0.5 millimole value. So this is the answer, and that is given in option A. So I hope that you have understood it. So like this is just illustrative example. Like this mini question can be drafted where they can ask you what is the value of Km, what is the value of velocity maximum. As I have told you, the velocity maximum is not represented here. Rather, 1 by velocity maximum is represented by the point which is touching, which is intersecting the y-axis at some point. The enzyme kinetic line, wherever it is like it is intersecting y-axis, that point is denoting you the value of 1 by Vmax. So tomorrow if they ask you the value of Vmax, that also you can calculate, right? So that value they have given you, and accordingly you can always calculate. Say for example the value is given 5 over here, so 1 by Vmax is going to be 5. So Vmax is going to be 1 by 5. So accordingly it is going to be 0.2, right? Millimole per minute, or whatsoever unit is represented here, right? So this is how. Any doubt in this? Sheikh Abdul, if you have any doubt, you can always ask me. We are here to discuss certain image-based questions, and this is in fact a question which is repeatedly asked, you know, in a different fashion in previous 2 or 3 years of exam. Right. Now let's proceed towards the next question if you don't have any doubt. Now this is the question, and they're asking you which type of bond is represented by dotted line in the image. Now what is this structure? Abdul, can you just tell me what structure is this? Can you make some sense out of this structure? What is this? Can you tell me what is this? Nitin, बताइए ये क्या structure है? They're asking you what is the bond which is represented by these dotted lines. So first of all you have to identify this structure. Yes, very good, Darwin. It's double stranded DNA. This is one strand of the DNA which is 5' to 3' like this, and this is another strand of the DNA which is 5' and 3' like this. So you have two strands of the DNA which is represented in this question which are anti-parallel. And whenever you're talking about the strand of the DNA, you must know what this line is representing you. Can you tell me, whenever we draw the DNA, if I ask you to draw double-stranded DNA, you'll just draw these two lines and you will make the anti-parallel strands like this. My question is, what this line is representing you? See, the whole structure of the DNA, which is like this one, cannot be represented every time whenever somebody is asking you to represent the DNA. So we have devised a very easy way to draw DNA, and that is just to draw a straight line. My question is, what this straight line is representing you? Yes, Aditya is correctly telling me it is no, it's not hydrogen bond. It is phosphodiester bond. Yes, phosphodiester bond. This phosphodiester, we call it as Aditya, we call it as phosphodiester backbone, right? So this line is representing you the phosphodiester backbone. Now, where is the phosphodiester backbone in this picture? In this picture, this is the DNA, right? So which color is representing you the phosphodiester backbone here? The yellow color thing. This yellow color thing is representing you the phosphodiester bond which are linking the nucleotides together. Now let me talk about this little in detail. It is very important to understand a nucleotide, and more important is to understand how the nucleotides are added together to make you a polynucleotide. In other words, I want to talk about two things. Number one, the component of nucleotide, and number two, the various bonds which are there in the nucleotide. And at the end, I will be discussing how the phosphodiester bond is linking the nucleotides together, right? So let's start with this discussion. So when I talk to you about nucleotide, most of you know that nucleotides are having three aspects in it. One is the base, which may be purine base or which may be pyrimidine base. Another is going to be pentose, which is either going to be the ribose or going to be the deoxyribose, depending upon what nucleotide you are talking about. Third component is going to be the phosphate, which may be 1 in number or 2 in number or 3 in number. So we have three components in a nucleotide. Now let's see how they are oriented. So I start with the pentose, and here what I am drawing is the ribose, C1, C2, C3. This is C4 and this is going to be C5. This is the ribose. When we say it is deoxyribose, we have to talk about this kind of structure which is not having oxygen at second carbon hydroxyl position. But when we say ribose, we have oxygen here, we have hydroxyl group here. When the oxygen is not here, we call it as deoxyribose or 2' deoxyribose. We call it as 2' deoxyribose. So this is a ribose, and on this ribose, when we have a base which is attached, which is kind of this one base, this is a purine base, and always remember it is always the N9 which is linking with first hydroxyl to make you one beta N glycosidic bond. Whether it is purine base or pyrimidine base, always the bond which is linking the base to the ribose first hydroxyl is the beta N glycosidic bond. It is always the N9 of purine and N1 of pyrimidine which is linking over here. This you have to remember. So this kind of structure where the base and the ribose are linked through this kind of bond is called nucleoside. And when one more component, the phosphate, is linked at 5th hydroxyl position, esterification, this is ester bond, it becomes a complete nucleotide. So this is a structure of a nucleotide which is represented as abbreviation NT, where you have purine base which is linked through beta and glycosidic linkage. You have phosphate which is linked through esterification, and of course the base is linked to the ribose and phosphate also is linked to the ribose. I hope it is clear. So whether it is purine nucleotide or pyrimidine nucleotide, you have this kind of structure. If I draw a, say for example, a pyrimidine nucleotide here, it will be drawn like this. You must practice this, otherwise you will not be able to identify the various bonds in the exam. This is another one nucleotide which I am drawing, is probably a pyrimidine nucleotide which I am drawing, and this is the N1 which is linked through beta N glycosidic linkage, right? Beta N glycosidic linkage. Now the question is how the nucleotides are added together. So for that you must know that third hydroxyl is interacting with fifth phosphate, and both are linked in a bond which is called phosphodiester bond, phosphodiester bond, because this is ester bond, right, as I've told you before, and this is also esterification. So this becomes a phosphate is in between, phosphodi means two ester bond, phosphate in between two esterification. So this becomes a phosphodiester bond which is formed and which links the nucleotides together. So this is how the further nucleotides are added and a long chain of DNA and RNA are getting formed. So if you see this structure now, after understanding these basic concepts, if you see this structure now, many things will be clear to you, that these are two DNA strands which are shown, and these are individual nucleotides of a DNA which are linked through phosphodiester bond like this, and similarly these are nucleotides of another DNA polymer which are linked through phosphodiester bond. These are the bases which are not the part of phosphodiester backbone, which are projecting in the space in between the two DNA strands. And please understand, the interaction between the bases are in fact the hydrogen bonds. So these dotted lines are representing you hydrogen bonds. Hydrogen bond is never seen in a single DNA strand. Nowhere it is seen in a single DNA strand. But when two strands of DNA, they come in approximation of each other, their bases are interacting through hydrogen bonds. The adenine is interacting with thymine and guanine is interacting with cytosine. Please understand, we have two hydrogen bond between adenine and thymine and three hydrogen bonds in between guanine and cytosine. So this you have to remember, two hydrogen bond in between adenine and thymine and three hydrogen bond in between guanine and cytosine. If you can see carefully, you can even see, even in this diagram correctly, they have drawn three hydrogen bonds between guanine and cytosine and two hydrogen bonds between adenine and thymine. So which association is stronger? Arvind, bataiye, you tell me. Amit, Aditya, which association is stronger? AT interaction is more strong or GC interaction is more strong? Of course, the GC interaction is stronger because they have three hydrogen bond. That is why we get another one concept of melting point of DNA. What is melting temperature? Melting temperature of DNA, melting temperature, melting point. The temperature at which 50% segregation of DNA occurs. So melting temperature will be higher for those segments of DNA which are having rich content of GC compared to AT. Because AT, they have weak interaction, they have only two hydrogen bonds, they tend to melt easily. But when you talk about GC melting or segregation, you need to have higher temperature. So melting temperature is going to be higher in those portions of the DNA which are having rich amount of GC component, right? Is there any doubt? So this question was pretty simple and it is frequently being asked. They just depict you the DNA structure and they may target you any bond. Now I've told you all the bonds. I've told you this yellow color highlighted portions of phosphodiester bond. What was this bond? Anybody? The bond which is linking the base with the rest of the nucleotide or the first hydroxyl of the pentose. What was that? It was beta N glycosidic bond, right? So this is how the various bonds are there. These are hydrogen bonds, right? तो ये आपको पढ़ना होता है. So Arun B, thank you very much for appreciation and remembering that I taught you and you liked my class. I'm really thankful for that. Thankful to God, and then I'm thankful to you also for understanding the concept behind the biochemistry. Ajit, this is biochemistry class going on and I am discussing certain image-based questions. Right. Amit Kumar wants to know that competitive, non-competitive inhibitors, how to identify them on Lineweaver work plot. Amit Kumar, your question is very good. Certainly, I will be taking that question. Okay, so this is Lineweaver work plot, and Amit Kumar wants to know that how to understand that competitive, non-competitive, uncompetitive inhibitors, how they're going to have their impact on the Lineweaver work plot, how to identify them. Great question. I will be taking that, Amit, now. That question of yours. Anybody else? All right, so you people are interacting. KM-Vmax concept. Okay, KM-Vmax concept. Anjali, it's very easy concept, and just because it's given in a very filthy manner in the books, you actually tend to get confused. I'll just come to that. Right, so I just hope that this kind of bond questions you'll be comfortable with later, and how the nucleotides are formed, how the polynucleotides are formed, then how two chain of polynucleotides are interacting, what is the concept of melting point, and which section of the DNA will be showing you the higher melting point. Of course, it is going to be GC rich portion, which is going to be higher, showing you higher melting point. All right, I take the Arun questions where he is asking about the effect of competitive and non-competitive inhibitors on Lineweaver work plot. So for that, there are few important baseline concepts, Arun, which you must know beforehand. And please understand that when we are talking about the type of inhibitors, their impact on velocity maximum and their impact on Km value, you must know beforehand, before going and learning how to identify these changes in the Lineweaver work plot or Mcqs plot. So this is no big rocket science. I just want you to know that when we are talking about competitive inhibitor, there are so many competitive inhibitors. Many pharmaceutical agents are being prepared which are going to act and inhibit the enzyme in a competitive fashion. So whenever we are talking about competitive inhibitors, they're going to have the same velocity maximum as the original value when the velocity maximum by that enzyme was shown in absence of inhibitor, but the Km value is going to be raised or increased. When competitive inhibitors are present, the velocity maximum will be same, but the Km value, that is the amount of substrate which is required to get half max value, becomes higher, because competitive inhibitors tend to pull down the substrate because it tends to bind the active site. So you need to have higher amount of substrate to compete with to get the half max velocity. So the Km value is nothing but it's a substrate concentration at which half of the max velocity is reached. So when competitive inhibitors are present, the velocity maximum will be certainly reaching to the same value, but the higher amount of substrate will be required, because to get the half max value itself, you get the higher amount of substrate. Of course, to get the exact Vmax, you need to have higher amount of the substrate than the original value when the inhibitor was absent. Similar fashion, when you're talking about inhibitors which are acting in a non-competitive manner. So non-competitive inhibitors, when they are acting, you need to understand that always the velocity maximum is going to decline, but to get the half of that new load velocity, incidentally the Km value is going to be the same. Now I don't want you to go into the technicality of this result, because that becomes too complex and that doesn't serve any purpose. So just remember that when non-competitive inhibitors are acting, where we see many of the kind of poisons, they act in a non-competitive fashion. They always tend to decline or decrease the velocity maximum. And to get the half of that new load velocity, incidentally, the substrate concentration required is going to be the same. And we have another one rare kind of inhibition, which is uncompetitive inhibition, which is when present is going to decline both the Vmax value as well as the Km value. Now this table is very, very important to identify these changes, to identify the changes and identify the type of inhibitor in Michaelis-Menten plot and in Line-Weaver-Burke plot. When I talk to you about Michaelis-Menten plot, we draw direct substrate concentration and velocity, and we get a plot like this, where this point is representing u Vmax, this point is representing u Vmax by 2, and this point is representing you the Km value, which is actually the substrate concentration required to get the half max velocity. When I talk to you about competitive inhibition, I told you the Vmax will be same, but to get the half of that new Vmax, you need to have higher amount of substrate. So the plot will be looking like this. This red color plot is seen when competitive inhibitors are present. How we see that? Because in presence of competitive inhibitors, the velocity maximum is going to be the same, and to get the half Vmax, the higher amount of substrate is required, which is represented by this much value in this plot. The same inhibitor, the competitive inhibitor, how it is changing the Line-Weaver-Burke plot, if I explain you that, you know it is 1 by Vmax value, and when merged on the minus x-axis, the point where it is intersecting the minus x-axis is 1 by Km value. This is 0. This is 1 by substrate concentration. Competitive inhibitor doesn't change the Vmax, so the point is going to be here. Competitive inhibitors increases the Km value, so 1 by Km value is going to decline. So when we merge these 2 points, we get a crossing line, and this kind of inhibition where the crossed line or crossing line is seen, it is talking to you about competitive inhibitors, because in this line, crossing line, you see the Vmax is same, so 1 by Vmax is same, and 1 by Km is a lower value, so Km is a higher value, and that is the criteria which is there for the competitive inhibitors, which I have told you in this table. So I hope, Arun, you have understood how the competitive inhibitors are going to show you the crossing line. When I talk to you about non-competitive inhibitor, in Michaelis-Menten plot, the non-competitive inhibitor, how they are going to change the kinetic, I will first tell you, and for that you need to draw the normal plot first. This is Km value. In non-competitive inhibition, the Vmax value is going to decline, and to get the half of that new lowered velocity, I said the Km value remains same. So the plot is something like this, which when calculated shows that in presence of inhibitor, the Vmax is declining. If I use red color pen, it will be clearer to you. So in presence of inhibitor, non-competitive inhibitor, the Vmax value is going to decline, and to get the half of that new lowered velocity, the Km remains same. This is the characteristic finding of non-competitive inhibition, and the same finding when represented in Line-Weaver-Burke plot, we get a line which is diverging. Let's see how. This is the normal reaction. When the inhibitor is not present, this line is representing you 1 by Vmax. This line is representing you 1 by Km. when non-competitive inhibitors are present. What you saw in that table, the Vmax is declining. So 1 by Vmax is going to show you raised value. Km will remain same. So 1 by Km will remain same. When these 2 points are merged, you get to have a diverging line, and diverging line is the characteristic finding in non-competitive inhibition. Non-competitive inhibition, you tend to have diverging line. So it's easy to remember. Crossing means competitive, diverging means non-competitive, and uncompetitive, they show parallel line. Uncompetitive, they show parallel line. Let's see how. Uncompetitive inhibitors, they show parallel line. Let's see how. Uncompetitive inhibitors, normal substrate, no inhibitor, 1 by Vmax, and this is 1 by Vmax, and this is 1 by Km. Uncompetitive inhibitor, both are declining. Vmax is declining, 1 by Vmax is showing you higher value. Km declining, 1 by Km showing you higher value from this 0. When these two dots are merged, almost a parallel line, this is uncompetitive inhibition. So uncompetitive inhibition. Now it becomes easy. I hope that you have understood it, that competitive, uncompetitive and non-competitive inhibitors all can be identified when, and very easily identified when, Lineweaver-Burke plot is used. The crossing line is competitive, diverging line is non-competitive, parallel line is uncompetitive. Amit, Arun, I hope that it is all clear to you, right? Yes, Ajit, yes, wow only. Crossing, C for crossing and C for competitive. Diverging, when you draw N, you see we all diverge this line, diverging, diverging. So non-competitive, you have diverging line. When you say uncompetitive, you have a parallel line like this, right? So it is very easy. Great. Now coming to next aspect of it, today's discussion, and you see this is a kind of picture of a baby which is shown. 2-year-old child brought with the history of generalized fits, born as full-term normal vaginal delivery without forceps, mother giving mousey odor in the urine. Mousey odor is which disease? Mousey odor, musty odor. Mousey odor is also called mousey odor or musty odor. Musty odor is seen in phenyl PQ, phenylketonuria. Yes, mousey is otherwise called musty also. So remember the odor always. It's a bunch sugar odor, it's a branch chain ketonuria, and mousey odor, it is otherwise called musty odor, seen in phenylketonuria. Baby is showing you delayed milestone and baby was lethargic. Hair was grey in color. This is a very catchy point. Hair is grey in color. You can see in the picture, hair is grey in color. So mousey odor urine, grey color hair, light colored skin, it's a characteristic finding of PQ, phenylketonuria. Because in this disease, what happens? The phenylalanine is not properly converted to tyrosine. Phenylalanine, we consume phenylalanine, it's essential amino acid. Except those quantity of phenylalanine which is getting directly incorporated into the polypeptide during translation, remaining all other phenylalanine, they undergo conversion to form you tyrosine. Because phenylalanine per se is not having its own metabolism. It has to first get converted to tyrosine and then only its metabolism takes place. And this tyrosine makes you melanin. It's a precursor amino acid for melanin formation. It makes you catecholamine. It makes you T3, T4. So you understand this kind of conversion of phenylalanine to tyrosine is so important. And if you talk about R group in phenylalanine, it is just a benzene ring in R. And when you talk about tyrosine, the R is actually the phenol group. You know, this is phenol. This is benzene ring. So what you understand that whenever we are talking about conversion of phenylalanine to tyrosine, nothing much is happening. Just the side chain of phenylalanine is the target of modification where the benzene ring is getting one extra hydroxyl group at para position, and that becomes a phenol group. And this kind of amino acid where benzene is converted to phenol is now called as tyrosine. So of course we need to have hydroxylation in this reaction, and we need to have enzyme called phenylalanine hydroxylase enzyme. This enzyme is not easy-going enzyme in the sense that it demands many things. It demands reducing equivalent. The reducing equivalent which is required here is a direct MCQ to you. See, the reducing equivalent may come from anywhere. It may come from any DPH. It may come from some reduced substrate like glutathione. It may come from tetrahydrobiopterin. And the donor of reducing equivalent is THP in this reaction. This is something very important. And this becomes dihydrobiopterin once it donates its 2 hydrogen in this reaction. Biopterin. So tetrahydrobiopterin is required, and then that's converted to dihydrobiopterin. We need to have reduction of this dihydrobiopterin with the help of NADPH for uninterrupted conversion of phenylalanine to tyrosine. So we need to have supplementation, the continuous supply of this NADPH which can donate its hydrogen to reduce the THP to THP. And you can even guess the name of enzyme. You can even guess the name of enzyme which is reducing the THP to form your THP, and that enzyme is called DHP reductase enzyme. We also have one enzyme called DHP synthase, which initially provides certain stock of DHP, which then is like involved in the reaction after getting reduced to THP and getting recycled. So you understand that it is not only one enzyme which is important for converting phenylalanine to tyrosine. How many enzymes we can see here? We see 3 important enzymes which play crucial role. So their uninterrupted function is required for continuous conversion of phenylalanine to tyrosine. If anything happens to any of these 3 enzymes, we get a disease called phenylketonuria. Of course, all of you know that deficiency of phenylalanine hydroxylase results in phenylketonuria, but again I re-emphasize on the sentence that deficiency of any of these 3 enzymes results in phenylketonuria, because deficiency of any of these 3 enzymes results in non-conversion of phenylalanine to tyrosine, which then in a lot of attitude will enter in alternate pathway, and that alternate pathway unfortunately is dangerous, where this phenylalanine is converted to phenyl pyruvate. First of all, alanine, pyruvate, the difference is amine group. Because of transamination, phenylalanine will say, I am going to form phenyl pyruvate, and phenyl pyruvate will say, I will form phenyl acetate by decarboxylation, and I may also form phenyl lactate. It depends on my mood by reduction. So what you understand, these red color metabolites are dangerous. Phenyl pyruvate, phenyl lactate, phenyl acetate, though a lot of them, they get excreted out in the urine, and we call this condition as a phenylketonuria. But these compounds are so dangerous that before they come out in the urine, they make havoc in the system. They doesn't allow the normal neurological development. They hamper the growth. They lead to mental retardation. This condition is called phenylketonuria, which we have been talking, and you understand the reason for graying of the hair in this baby because of non-melanin formation, because phenylalanine is not converted to tyrosine. One frequent question they ask you, what is the reason of odor, mousy odor, musty odor? Which component out of all these 3, anybody is responsible for mousy or musty odor? The answer is phenyl acetate. So just mark phenyl acetate. This is the compound which is going to give you mousy or musty odor. Phenyl pyruvate and lactate, they are odorless. Yes, Amit, you're totally right. Phenyl acetate gives you mousy or musty odor. right? So this, what is the treatment of this baby who is suffering with phenylketonuria? Now the 2-year-old child is brought. It is now too late, for this child, for the complete reversal, because baby already has mental retardation, kind of fits and all. Those going to be irreversible. See, the phenylketonuria should be treated within 10 days of life. The treatment must begin, and the only treatment available is dietary regime to be followed strictly, where phenylalanine restriction is done and tyrosine supplementation is done. If you really understand the restriction of phenyl, you cannot completely stop giving the phenylalanine in the diet. Like in galactosemia, we say stop galactose, stop lactose, do not give even a drop of galactose and lactose, and baby does fine. But in phenylketonuria, you cannot afford you cannot afford giving a diet which is completely free of phenylalanine, because phenylalanine is a amino acid, and it's mandatory that you need to supplement certain level amount of phenylalanine for proper protein synthesis. So restriction of phenylalanine is to be done, and supplementation of tyrosine is to be done. Supplementation of tyrosine, so tyrosine becomes an essential amino acid. But these all regime should begin within 10 days of life. That is why we say it is an important disease which should be screened in the newborn. So Mousey odor, musty odor, is a very characteristic finding, but mother may not notice it. Clinician may not notice it. So always it is important that you screen the newborn for this particular disorder, because treatment need to be instituted immediately. For the screening, the test which is done is the ferric chloride test, which is very easy test, where in the test tube 5 ml of urine is taken, patient's urine, baby urine is taken, and few drops of ferric chloride is added. Say for example 5 drops of 10% ferric chloride is added, and it's shaken. And suppose if the test tube is showing you the leafy green color, that denotes you positive ferric chloride test, which is a screening test, and this is to be confirmed with another test, which is Guthrie test, which is done with the help of blood of the baby. In this Bacillus subtilis, spores are taken. This is Bacillus subtilis, spores are taken, and baby blood is added in this. Right, baby blood is added. If the baby blood is having lot of phenylalanine because of phenylketonuria disease, the phenylalanine is not metabolized, the Bacillus subtilis will grow and will make colonies like this. So this is called Guthrie test, and this is a confirmatory test. Bacillus subtilis will grow only when the blood is having high level of phenylalanine, and that's a confirmatory test for phenylketonuria. Right? Any doubt in this? Ferric chloride, the leafy green color or bluish green color is the positive color, but that ferric chloride test is given positive by many disorder inborn amino acid urea like alkaptonuria, tyrosinemias, and homocystinuria. We tend to have this positive ferric chloride test. So we have to confirm the positive ferric chloride test with the help of Guthrie test. So in this question, the question was supplementation of which amino acid is beneficial in this child, and also select the compound responsible for Mousey odor. Now you've got the answer of both. So tyrosine supplementation and phenyl acetate is the reason for odor is the answer here. So that is the answer here, right? All right. Alright, very good. So now let's discuss few more questions, and coming to this slide, where I have just shown certain crystals which are seen under microscope. Can you identify these crystals? These are osa zone crystals. which probably you have seen in your first year MBBS. Under microscope, these are crystals. These are what appearance they are showing. They are stick shaped, broomstick appearance, needle shaped. Needle-shaped osa zone. Needle-shaped osa zone seen in which all compound? They give you this needle-shaped osa zone. Glucose, fructose, mannose. They give you this broomstick or needle-shaped appearance. So this is a test which is basically not being done very frequently in the undergrad's lab, but in my opinion it should be done because it clearly helps you identifying the glucose in the urine or the fructose in the urine, because they all are reducing sugar. If Benedict is positive, you say Benedict is positive, so some reducing sugar is there. So unless until you make the osa zone, you cannot be very clear that which reducing sugar it is. Like lactose is also reducing sugar, but that gives you a different shape of osa zone. Maltose is also a reducing sugar that gives you a different shape of osa zone. So can you tell me which shape the lactose is giving you after making you osa zone, lactose zone, what shape it is showing, and maltose, what shape it is showing? Can you just tell me? Lactose zone, what shape the lactose is showing you? I'll see if I have those pictures. Yes, this is lactose zone. What appearance you can see here? Lactose. It's an old tennis ball appearance. We call it as, this is lactose zone. Lactose zone. And it is old used tennis ball appearance. You can see the hairy appearance, right? Pin on cushion effect, right? Pin on cushion effect. Old tennis ball. Touch me not flower. Have you ever seen touch me not flower? It looks like that, though not pink in color. So yes, Ritika is telling me so many names. Hedgehog, touch me not, old tennis ball, pin on cushion. Very good, Ritika. You remember them all. Hedgehog appearance. You see on Google how the hedgehog looks like. So these are you see powder puff appearance, powder puff also. The baby, the mother at times, they used to use initially the powder puffs to put powder on the baby. So powder puff appearance, touch me not, pin on cushion, cotton ball appearance. So these are different interesting names which are given for lactose zone, and you must know them all, right? And for maltose zone, you have sunflower appearance. You can see this kind of, it's very difficult to prepare. Like I personally have found very difficult to prepare the maltose zone, and making of lactose zone and the glucose zone and all is easy, but maltose zone, it's very difficult to get success in making maltose zone. And this is a very typical appearance, which is sunflower shaped maltose zone, so remember that. So what I mean to say that though it's an obsolete practice, but in MCQs things are, in your kind of exam, these kind of questions are not yet obsolete. So they have their own practical significance, because once we make osa zone, which is using a very important chemical called phenylhydrazine, and by certain steps it is going to make you osa zone. You have to boil it, cool it, spread it on a slide, and then examine. You have these different kind of shapes, right, for various osa zones, right? TK Ritika remembers all the names. Now can you tell me what it is? 7-year-old child presenting with blistering and hyperpigmentation lesion on the skins. You can see the back of hand having so many blisters and all. Urine examination is showing, just a second, I will, हेलो, हाँ बोलो, हाँ बताओ. ठीक है, तो कल करवा लेंगे। तुम निकल गए हो? ठीक है, कोई बात नहीं, मैं देख लूंगी। ठीक है, कोई बात नहीं, ठीक, ओके ओके। So what I was telling is that this is a case where 7-year-old child is presenting with blistering and pigmentation, and urine examination is showing you sharp band which is showing the peak absorption at 400 nanometer wavelength, right? This is the peak absorption. This is OD, absorption unit, and the various wavelength light is passed, and suddenly at 400 nanometer wavelength it is showing you peak absorption. To be exact, it is 405 nanometer. This is called Soret band, and it's characteristic finding in the urine of a patient who is suffering with porphyria. So any kind of porphyrinogen, when excreted in the urine, whether it is protoporphyrinogen or coproporphyrinogen, it tend to show you the peak absorption at 405 nanometer, and this is actually the Soret band which is over here, and it's a cutaneous lesion. Of course, you can think of PCT, you're right, because it's one of the most common porphyria, and you have blistering kind of lesions like this. So this is how it is identified. So this urine examination, after adding certain drops of acid and passing various wavelength light and examining it in spectrophotometer, is a very important test to screen, in porphyria. Now, can you answer me this question? Nitin, can you answer me this question? 1-year-old male child brought to the OPD with fits 2 days ago and overall developmental delay, non-consanguineous marriage and fair complexion, scarce hair, which was very easily fragile, and limb hypotonia was seen. हेलो, हाँ जी, हाँ बताइए। तो कब आइएगा? किस टाइम? ठीक है, नहीं आप 1 बजे के बाद आइएगा सैटरडे को। हाँ जी, ठीक। So this child is suffering with fits, fair complexion, hair problem is there. You see easily fragile hair, limb hypotonia. Microscopic examination is showing you twisted hair. Blood investigation result is showing you the low copper serum copper is 45 microgram. Celloplasmin is also low. This is kind of picture the baby is showing. So what may be this disease? Yes, Nitin, you're right. It's a minky-kinky. When they're talking about copper, low level of copper in the plasma, low level of celloplasmin. See, the normal copper is 70 to 155 microgram per deciliter, but this child is having less than 50. The celloplasmin is 185 to 300, but celloplasmin now it's less than 50. So it's a minky-kinky, because minky, kinky, steely hair syndrome. This child is having this problem. Kinky, kinks in the hair. Microscopic finding is steely, that is steel color, grey colored hair. This is the disease where there is a mutation of a protein, mutation of copper binding ATPase 7A. This is a protein which is there at GIT mucosa. This is lumen of GIT. This is mucosa of GIT. This is blood vessel around the GIT. You consume copper, it enters the mucosa. From mucosa, it must enter in blood vessel. To absorb the copper from GIT mucosa to the blood vessel, you need to have a transporter which is copper binding. This transporter name is copper binding ATPase 7A. And when this is mutated, the GIT mucosa is loaded with copper, but it is not absorbed in blood vessels. So blood vessels will not have copper, the various system, the liver, the organs will not have copper, and the absolute deficiency of copper will be there. Tyrosinase enzyme, which is needing copper for making of melanin, will not act because it says by copper law, then only I will act. So because of that, the graying of hair and light skin. That is why the name of the disease is steely hair syndrome. This is due to absolute lack of copper. So you have to give copper during treatment of this baby, but not orally, because it is not absorbed, it's not going to the blood vessels. You have to give copper, as a complex of histidine, copper histidine complex, and you have to give it an injection. Parenterally, you have to give copper IM injections to be given. This is minky kinky steely hair syndrome, where this kind of problem is there and GIT mucosa, though loaded with copper, the system is having, other organs are having absolute lack of copper. You must not get confused. You should know that we have another transporter which is copper binding ATPase 7B. This transporter 7B is there at the hepatocyte, and there its duty is to excrete excess copper from the liver to bile canalicles, from where they are coming out of the system. Like the 7B transporter takes the excess copper, drops it to bile canalicles, and via bile it is like coming out of the body. This transporter is mutated in which disease? Mutated in Wilson's disease. So Wilson's disease, the problem is in excretion of excess copper, and in Minky disease, the problem is in absorption of copper from GIT mucosa. The name of transporter looks same, but please understand it is 7A in Minky, it is 7B in Wilson's, right? In Wilson's, the system is troubled with excessive copper, but in Minky, system is troubled with deficiency of copper. And as far as the ceruloplasmin level is concerned, both the disease, whether it is Minky or it is the Wilson's, you will have deficiency of ceruloplasmin, which is a protein which is binding so many copper with it. They both are going, both the conditions, this level of ceruloplasmin will be low, because liver is not able to secrete the copper and give it to apoceruloplasmin. Ceruloplasmin is not synthesized properly, its level is low. And in Minky disease, when absolute deficiency of copper is there, liver will say, kahan se do copper? So the ceruloplasmin level will be low. So this is all about Minky disease, and this was another one question which where I asked about the bonds, but the first question which I discussed was, second question I guess, was the same thing. And this is a structure of anybody? Aine said 21. Anybody? This is a structure of, can you see what is written here? Hyaluronic acid as a, black color line in the center. It's a bottle brush appearance. So bottle brush appearance. Can you guess what is this structure? This is agricon structure, which is a proteoglycan. It's a very typical structure which is called bottle brush appearance, or otherwise called caterpillar appearance, and this may be asked to you. So it looks so beautiful. Now they can always ask you, what is this structure? You see there is a central axis which is hyaluronic acid, you have got link protein like this, you have got core protein like this, and these bristles are all different mucopolysaccharides. So you have a protein, you have mucopolysaccharide, it is a proteoglycan. You have got so many variety of proteoglycan. All of them, they do not have this kind of typical picture, but agricon, which is one of the most abundant proteoglycan, is showing you this kind of a structure, right? Yes, Wilson may be low. Ajit, ceruloplasmin is low in both the conditions. Why? How? I have explained you. In Mcqs disease, the copper is not there. The liver is producing apocylloplasmin, but when copper is not there, it is not binding apocylloplasmin, so celloplasmin is not formed. And in Wilson's, copper is there abundantly in the liver, but it is not able to secrete it so that it binds with the apocylloplasmin. So again, celloplasmin level is low. So both conditions, the celloplasmin level is low, but in Wilson's, you have rather high copper as such, which is like absorbed from the mucosa. But in Mcqs, you have lack of copper. When you do liver biopsy, in Wilson's you have got lot of copper in liver tissues, but in Mcqs you have deficiency of copper in the liver tissue. Right. Thank you very much, guys, and I've got another session after this. So, love you all. A beautiful batch. All 50 of you are wonderful. Thank you, everybody. Thank you, Ajit. Thank you, Nitin. I hope that you are benefited by these image-based questions. So stay tuned. We will come with much more pictures like this, and we'll have interesting discussion and see how the questions to be attempted. Right. Chalo. Wish you all the best. Thank you. Bye-bye.